Hey folks, Doug Blake with Body Design University. In this video, I'm going to try and clarify an issue associated with the bend and lift assessment, the squat pattern, which you're going to find on page 431. This is in chapter 10, and this is the muscular training assessment. Of course, if you've gotten through up to this chapter, obviously a very important chapter, and the bend and lift assessment, very important part of the chapter that you will get for sure tested on for any number of questions. But the idea is that the movement assessments generally are going to begin with this first assessment, bend and lift. And it's important just to keep in mind that anytime you're doing assessments like the squat or the bend and lift assessment, just keep in mind, obviously everybody is different, every client is different. And so this is why it's important that, as you read through and memorize table 10, 16, for instance, you got to memorize, obviously, as much of this as you can. The view, the location is easy enough to understand, but then the compensation and the key suspected compensations of overactive and underactive, tight and lengthened muscles, that's important. But again, the key here is to understand that because everybody is different, there's going to be very subtle differences in what you're looking for and how you assess that particular squat pattern assessment that you're doing. So that's why ACE has given you on page 432 two really valuable expand your knowledge boxes. Now, I'm not going to go into the squat and lunges one on 433, but on 432, and I get this question all the time from both trainers that are already in the field training people, and of course, students that are trying to figure out the difference here between lumbar and quadricep dominance. And that's why this is a very helpful expand your knowledge box. So, and you're going to see that figure 1044, the hip hinge goes along with it. Now, before I get into that, I just want you to understand that in explaining this and understanding this, the best way to start is not lumbar dominance first, quadriceps dominance second, is glute dominance, because what is known as glute dominance is actually the normal way to squat, or the preferred way, effective way, safe way, most efficient way to squat is through what's known as glute dominance. So in a sense, they're giving it a term, glute dominant squat, but in reality, this is how you squat. Okay, if you're a competitive power lifter, you're a bodybuilder, this is the way we have always squatted, number one, and then taught people how to squat. And it can take a fair amount of time to get people to do it correctly. So what I want to do is tell you to come on down in the movement patterns during a squat, go to the glute dominant one first. And basically it says, glute dominance implies reliance on eccentrically loading the glute max during a squat movement. Okay. For the most part, the first 10 to 15 degrees, like you're standing up, and as soon as you start to bend at the knee and bend at the waist, those first 10 to 15 degrees, I mean, it's a really, really small range of motion, the first 10 to 15 degrees of the downward phase. So on the way down, your glutes and your quads are being eccentrically loaded, right? Meaning they are lengthening under tension, which means they are under the eccentric portion of the contraction, right? Eccentric muscle is lengthening under tension. So the terminology eccentric loading simply means that you're starting to squat down, right? The hips are going down. First 10 to 15 degrees and again, this is the proper way to squat. This is what we're always trying to get people to do. And you may have heard it said that, not everybody can squat and not everybody is designed to squat. And there is an element of truth to that. Obviously, the length of the femur, an individual's femur length, and femur to tibia fibula length, that ratio has a lot to do with how comfortable a person feels when they're doing a squat. Some folks, it's a lot easier than for other folks to do the regular squat. And but the point is that everybody can squat, because what I will normally do is I'll ask somebody, do you get into your car? Do you sit in your car, or you get up and out of your car? Oh yeah, of course. Then you can do a squat. Now, your range of motion may be limited because of the unique biomechanics of your lumbar, your pelvis, your hips, your femur, and all the other variables that go into the biomechanics of performance. But everybody can do a squat. Sometimes you got to put your feet a little wider apart. I always say, when in doubt, go out. Put your feet wider apart. The wider the feet go, the more actual movement you have in the pelvis while it's sitting on the femur bones. So more pelvic movement, that gives you the better ability to hinge at the hip, which is the key to a squat. So that's basically what they're describing here. First 10 to 15 degrees of the downward phase is initiated by pushing the hips back. Now, I would not use the word pushing or driving this forward or something like that. It's really pretty simple. If you put your weight as you're starting to squat down, if you simply put the weight on your heels, you're not pushing your hips back. You're simply allowing the hips to sit back. And so the entirety of your body weight starts to go down and backward. That means that the hips are going to sit back slightly as you start to go into towards the bottom position. Again, the key here is what I always tell my clients is think about putting all the weight on your heels, or shift some of the weight on your heel. And that's going to kind of get them to put their hips back. And that's basically what this is. So, okay, push the hips backward, whatever. This creates what's known as a hip hinge. This is a difficult concept for some people to figure out. Now, remember, this is biomechanics, and not everybody has this high kinesthetic sense of where the positioning of their limbs are. So that's one of the reasons why, again, I would tell somebody to keep their rib cage up, sit the weight on their heel, the hips sit back, and literally hinges forward. Now, this is pure hip flexion, okay? Not spinal flexion, right? No lower back. And if you look on page 432, you can see the picture in figure 1044. She goes from a standing position, and just initially the hip sits back, and you see hip flexion occurring. But notice her back is essentially straight. It hasn't really changed position, i.e., the lumbar lordotic curve has not increased or decreased. That's the ideal situation. So initiated hips back, creating a hip hinge. In the lowered position, this maximizes. So here's the key. What we know is that when you do a squat correctly, the initiating eccentric load hits the gluteal group, or the gluteus maximus. Okay. Now, that's fine if you want to say it like that. In reality, there's engagement of every single muscle. When it's done correctly, every single muscle that you can think of, that you can name, maybe you can't name them all, in some way, shape, or form starts to tighten up, to either stabilize, assist, or help with the dominance of the gluteal group, which is now holding, or essentially dealing with, the load of the entire upper body generated now through the hip, going through hip extension, right? Because that's what's happening. If your hips are flexing, then the extensors, right, at the hip, i.e., the hamstrings and the gluteal group, those guys are eccentrically loading. Okay. So if they're eccentrically loading, that's going to be the initiating sort of, I guess you could say, power source for slowing the movement on the way down, right, through the eccentric portion. And that's all it's saying, is that in a properly performed squat, it's the gluteal group that basically jumps in first and initiates that downward slowing or eccentric loading at the hip. So in the lowered position, this maximizes the eccentric loading on the gluteus maximus to generate significant force during the upward. In other words, proper eccentric loading allows for effective concentric contraction. Though this loading phase ensures that the gluteal group is under the appropriate maximal contractile state prior to doing the concentric contraction on the way up. When all is said and done, we say that squats are a quad exercise. Well, yeah, of course it's a quad exercise. But remember, it's also a gluteal exercise. It's one of the reasons why, for the most part, you can train glutes on their own, But properly done, when you start getting clients doing squats on the regular and they're doing it correctly, tremendous amount of gluteal activation associated with that. Whereas I've never really ever trained gluteal group exercises with clients on their own unless they were athletes. But for the average client, just the proper squatting alone puts a tremendous amount of stress on the gluteal group. So that's basically what glute dominance is. It is the proper or appropriate way to do a squat. The glute dominant squat pattern is the preferred method of squatting. Therefore, I don't need to call it anything other than proper squatting. But the idea is that we're really focusing on the gluteal group when we're doing squats from a proper biomechanical perspective. You really got to watch those hips. You got to watch the hips and what's happening at them if you want to maximize the effectiveness of the exercise and reduce injury potential as well. Spares the lumbar spine, relieves undue stress on the knees. Absolutely. Glute dominance also helps activate the hamstrings. One of the key things, interestingly enough, about the hamstrings during squats is that they act as a primary stabilizer. Where? At the knee. This is a really critical component that's often overlooked. One of the reasons why you don't want to do certain exercises, like the if you've ever used one of those machines that allows you to kind of put all your weight back behind you, for instance, you don't want to reduce the tension of the hamstrings. You want to keep the hamstrings. They should be very, very tight. Now, one of the reasons why the hamstrings tighten up and pull the tibia fibula complex, which holds the knee in place, right? One of the reasons that happens is because you're eccentrically loading it. And whenever you eccentrically load a muscle, it's going to create a lot of tension in the muscle. The tension from the hamstrings generated at the hips actually goes to the knees as well, because the entire muscle group contracts. And all that's doing is it's reducing the stress load that could potentially be placed as the tibia wants to move anteriorly from the knee. So that's where the ACL comes in, the anterior cruciate ligament. So when all is said and done, by doing the squat correctly and hinging at the hip, you activate the gluteal group effectively, and of course you activate the hamstrings. Activation of the hamstrings by flexing the hip then creates a normal simultaneous activation of the entire muscle down to the tendon attachments into the tibia fibula complex. By doing that, it pulls, you can imagine that this is my lower leg. The hamstrings attach on the lateral and medial aspect of the tibia fibula complex. This is my femur. Essentially what happens is it gets pulled. The hamstrings, when they tighten up, pull and create a stable environment at the knee. If the hamstrings do not effectively tighten up and create tension and pull the knee joint in and holding it fast, then the potential for the anterior displacement of the tibia fibula complex is what stresses the ACL. And that's what we see. So just finishing up, glute dominance helps activate the hamstrings, which pull on the posterior surface of the tibia. In other words, that's what I was telling you, the lateral medial aspect pulls the tibia back up into the head of the femur and helps unload the ACL, because the ACL's job, the anterior cruciate ligament, is to ensure that the tibia does not move forward within the knee joint. Hope that makes sense. You think about the knee, the tibia, the femur, the tibia fibula complex, that lower leg can actually move forward and slide anteriorly. And the ACL actually holds all that in place to make sure that your tibia fibula complex don't drive forward. And so that's what it helps to do. So glute dominance, for the most part, is the proper way to do a squat. Now we come to the two problem areas when doing the squat. And the first one is lumbar dominance. It implies a lack of core. Now, from a testing perspective, this is what you need to know. Lumbar dominance implies what? A lack of core and gluteal muscle strength. Okay. If the gluteal group, like if you sit down all day and the glute becomes lengthened and underactive, you know, it's not probably not going to activate the way it needs to under the eccentric movement pattern. So it's not going to pick up it's not going to load effectively during the eccentric movement because it's already weak. It's lengthened. It's underactive. So the implies a lack of core gluteal strength to counteract the force of the hip flexors, erector spinae as they pull the pelvis forward during a squat movement. Remember, you have to flex the hip. Flexion of the hip implies anterior tilting of the pelvis, right? The lumbopelvic hip complex. So that anterior tilting is performed by what? The hip flexors and the lumbar extensors, or the erector spinae. So if those guys are really strong, what ends up happening is that the gluteal group now has to compensate for those very powerful anterior tilting of the pelvis muscles, right? So as the pelvis tilts anteriorly, right, to the front, those two simultaneous muscle pulls can be very, very strong and overactive, and is what happens. If the gluteal group cannot compensate or increase its eccentric loading capacity, you get what's known as lumbar dominance. And basically what it looks like is a person that goes down into a squat that just really is arched way up, okay, really arching in their lower back, and you don't see that movement backward with the hip to get the appropriate hip hinge, right? So that's lumbar dominance. In this scenario, individual experiences excessive loads within the lumbar spine as it moves into extension during the squat. Muscles of the abdominal wall, gluteal complex, do not contribute enough. Now remember, the hip flexor, and this is where it can be a little confusing. See, what it says is the abdominals, and you're thinking to yourself, well, don't the abdominals flex the hip? No, the abdominals flex the spine. You get that? Hip flexors anteriorly rotate the pelvis, okay, or lift the femur. The abdominals do not, your rectus abdominis does not do that. What the rectus abdominis does, because it inserts into the pubic bone and the sternal aspect of the rib cage, this area up in here, it flexes the spine. Remember, those are two different movements. Hip flexion and spinal flexion are two different movements. The hip hinge is not spinal flexion, like you're rounding your back forward. The hip hinge occurs at the hip. So your hip flexors are different than your spinal flexors. And that's where people get confused on this. So the muscles of the abdominal wall, which are not hip flexors, they are spinal flexors. They act in opposition or antagonistic to the lumbar extensors. Okay, so the erector spinae are antagonistic from a kinesiological perspective to the rectus abdominis, or the abdominal muscles. Okay, got to keep that in mind. The hip flexor muscles, like the iliacus, psoas, or iliopsoas, and the rectus femoris, those are hip flexors. They are counterbalanced, or their antagonistic muscles are the hip extensors, the gluteal group and the hamstring. See the difference? You got to know those differences, especially from a testing perspective. So lumbar dominance, chronically type hip flexors, such as those experienced by individuals who sit for prolonged periods of time throughout the day, may also contribute to the problem. Yeah, they do. And by the way, you're going to find that the people that have the most pain in their lower back, yeah, and you know what I'm talking about, where individuals just have, the achiness in their lower back all the time. So think about it. They sit all day, their back aches, and then when you do this assessment, they're basically lifting and arching their back, right, to do it, and they can't even get down all the way. And that's probably lumbar dominance. And of course, this should impact, obviously, your programming. So that's lumbar dominance. And then you have quad dominance. Don't often see this that much, but of course we see it. Quad dominance simply implies reliance on loading the quads, especially during the initial movement downward. So instead of sitting the hips back, basically the knees go forward. That's a classic example of quad dominance. And sometimes it's as simple as telling the person, sit your hips back. and then they'll sit their hips back. But in general, if they initiate the movement, they initiate that movement with the knees going forward. Now they use the word, let me see, degrees down by driving the tibia forward. Just say driving the knee, just the knee moving forward. That's the initiating movement, is the knees go forward versus the hips sitting back. Okay, and that's what quad dominance is. So first 10 to 15 degrees of the downward phase initiated by, they say, driving the tibia forward. I don't like that terminology. As a person starts to sit down, their knees go forward. That's basically what happens. Creating shearing forces, yes, across the knee as the femur slides over the tibia, yes. Okay. In layman's terms, it means that the femur, the head of the femur, and the head of the tibia fibula complex, basically, when you're standing up straight, they are doing this. And as soon as the knees bend, it's the tibia moving forward, and that creates shearing forces within the joint itself. Not good. Okay. In this lowered position, the gluteus maximus does not eccentrically load. Why? Why doesn't it eccentrically load? Because you're not hinging at the hip. You're essentially taking your upper body, it may lean forward slightly, but you're trying to go straight down. So the hips are driving straight down versus down and back. And when you're standing and you start to bend at the knees and your hips don't hinge forward, well, obviously, mechanically, the knee has to move forward and if that's going to allow the torso to go straight down, and that is not good. That's the problem. That is quad dominance. And so the glute does not eccentrically load, cannot generate much force during the upward phase. I will say this, that people with quad dominance generally don't go down very far to begin with. And so it's fairly easy to get them to refocus by putting their feet a little wider apart and telling them to sit their hips back and put all the weight on their heels. Now, that's how I cue and correct 99% of the time. It works, but at least it tells you something about their initiating issues, which would be quad dominance. Quadriceps dominant squatting transfers more pressure into the knees, placing greater loads on the ACL. Okay, so lumbar dominance, right? Overarching of the lower back, pain and achiness in the lower back is a good indicator. Quad dominant squatters, people that can't get out of that, or that's the first thing they do, they're just putting undue stress on their ACL, on the anterior cruciate ligament, and they're not getting the quads to activate significantly enough. So keep in mind, you've got two problematic ways to do squats, and you got the correct way to do squats. From a testing perspective, lumbar dominance, overarching increased lordotic curve when the person starts to sit down and puts excessive stress on the lower back, and will increase or initiate low back pain, especially if they're not feeling low back pain, and then they start training with you and they start feeling low back pain. It could be because they are lumbar dominant. You got to keep an eye on that. Quad dominant, just in a way, just the opposite. They don't hip hinge. They just drive the knees. The knees drive forward or move forward, way over the toes, whatever the case is. And they'll probably feel pain in their knee, to be honest with you. And of course, they're just simply not getting enough glute activation when they're doing a squat. So if you understood this and this video was helpful, please write the word understood in the little comment section. By the way, if you want access to the full ACE exam study prep course, click the link below in the description box. So we've got full analysis of the chapters along with practice exams, quizzes. We have an entire Quizlet classroom with study sets for all 16 chapters as well, plus many other resources that are part of that exam study prep. Again, click in the description below to get full access to that. As always, if you have any questions, leave them in the comment box. And just so you know, every Wednesday night, 6 p.m. Eastern Standard Time, 6 p.m. Eastern, from 6 to 6:30, we do a Quizlet Live. It's sort of like a game that we can play using Quizlet, like Quizlet Live. So it creates a competitive environment Lots of fun, very fast, very quick, very helpful when it comes to studying and trying to memorize the terms and concepts that you have to if you're going to pass your ACE exam. So if you can do it Wednesday night, 6 to 6:30 p.m., we'd love to have you there. Go ahead and let us know how we can be of any further assistance. Have a great rest of the day, and we'll see you next week. Thanks.